there. Today we're working on increasing the space in your hip joint so that you can have some increased ability to bring your knee up to your chest, aka hip flexion. Hip flexion might be a little bit painful. Maybe when you go down into a garland pose or a deep yoga squat, you feel like there's just some compression in the front. So this is something that can help with that. It also, it's something that can be a little bit preventative of developing early things like arthritis or labral tears or hip impingement. So grab a strong TheraBand, a yoga strap, any sort of stretching strap, even a bathrobe strap, and lay down with me on something of a firm surface, the floor, maybe a firm bed, a yoga mat, and we're going to have both knees bent to start. You're going to take your yoga strap or your TheraBand and hold it maybe 12 to 18 inches apart. That being said, if you have a TheraBand, I want you to hold it so there's some pretty firm resistance. So you should stretch it so that you can hold it nice and tight, because you want to have a little bit of force behind your hands, but not a lot. I don't want you to have more than 10 or so pounds of push. You know what I'm trying to say with that TheraBand or with that yoga strap, but you don't want it to be loosey-goosey either. So bring that knee up to your chest and then take your band right to the spot where thigh meets trunk, okay? We're right over your hip joint here. So your hands are facing palm down as you grip your strap or your band, and as you draw your knee to your chest, you're gonna gently push the band away. So the classical motion is hip flexion, right? That knee is coming up to your chest. But what your band or your strap is doing is they're doing an arthrokinematic motion. It's pushing on the head of that femur, pushing it in an inferior direction, so in an inferior glide, because the head of that femur needs to glide inferiorly when you flex your thigh up toward your belly. So this is a mobilization with movement technique. So you can do it super gently at not at full range, and that can be a nice pain relieving thing when it's just at a gentle range, or if you want to take it farther to work on the ability to really fully bring your knee up and you're not in a painful state, then draw your knee up and push a little more firmly. And then you can hold that push and just gently oscillate that knee, flex, unflex, itty bitty ones, just like this. Try adding that in a few times a week to the beginning of your workout. Maybe once you've already done some core exercises, things like that. And let me know how it goes. All right, thanks. Have a great day.